So you get rhythms that are abnormal that come from the ventricle, and that can take you out very quickly.
And the ventricle is that bottom part of the heart that pushes most of it out to the rest of your body.
That's right. And so you can get very bad arrhythmias and cause sudden death. We see this sometimes in our athletes. The athletes get very dehydrated, they're running, heart rates are up, bam, can have a really bad rhythm issue that can cause sudden death.
Welcome to our podcast. The better you are, the better you are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us.
So it's been pointed out, taking a history is very important. And Dr. Pyles talked about taking a history as he's talking to patients. We all take histories. As a dentist, Dr. Dungy, I know history is important to you as well.
Well, just because we were talking about blood pressure and medications, and it's just important to know, especially as patients, please bring in your medications, your list, so we understand. You wouldn't maybe put the two together, but there's high blood pressure medications that can lead to conditions like a burning mouth or bleeding gums or dry mouth, which is very, the kryptonite of dentists, and or lead to funny taste like metallic taste or taste that tastes different than they used to. What was sweet doesn't taste sweet. What was sour tastes different, bitter is different. And so usually they don't go to the doctor, they go to the dentist and say, why does my mouth taste funny, right? And so we're gonna wanna know those things. And if you're on those medications, we're gonna look at that a little bit further. That was the point that I wanted to make.
And I think, certainly taking a history for all of us is important, but for you as well, Dr. Dawson.
Absolutely. My biggest thing is a family history is more important than we know. One of the big things, even with my own family, is we have a significant heart disease in my family. And so when my cousins ask me things, I'm like, no, you need to know this information. We have to share it. We have to talk to each other because family histories are important, not just mom, dad, and siblings all the time. Sometimes it's just as important to have aunt, grandmother, history. So for instance, my aunt had an aortic aneurysm, my cousin had an aortic dissection. That puts me at increased risk of having heart disease. If someone in your family, like your uncle, died before the age of 50, you have an increased risk of cardiomyopathy. So these are the things which is, cardiomyopathy is big heart, but in this particular one, you could die. So all those basketball players you see that die suddenly on the basketball court, that's because they have a family history or they may have hypertrophic cardiomyopathy, which is a big thing.
And I can imagine in those patients, Dr. Pyles, that vascular screening is important and attention to heart rate and irregularities of the heart rate are very important. Could you talk a little bit about that?
Yeah, we have out in the community vascular screening that costs $49, where you can get an ultrasound of your carotid artery to make sure there's no plaque or blockages there. You can also get a screening abdominal ultrasound to make sure you don't have an aneurysm or a large aorta, and also take your blood pressure in your arms and leg to look at the blood flow to make sure you don't have any significant peripheral vascular disease or reduction in blood flow in your legs. All these, if abnormal, can lead to significant cardiovascular disease. And you bring up a great point about hypertrophic cardiomyopathy. This is the disease where the heart is very, very thick. And actually, there's a problem with the cells of the heart. The cells are in disarray. We call it myocardial disarray, where the cells do not contract in a normal fashion. And that leads to what we call ventricular arrhythmias. So you get rhythms that are abnormal that come from the ventricle, and that can take you out very quickly.
And the ventricle is that bottom part of the heart that pushes most of it out to the rest of your body.
That's right. And so you can get very bad arrhythmias and cause sudden death. We see this sometimes in our athletes. The athletes get very dehydrated, they're running, heart rates are up, bam, can have a really bad rhythm issue that can cause sudden death. And that can lead to problems in the future that can be genetic. It's something that family needs to watch out and get into family history. If you have that, then you need to see a cardiologist because there are certain things that we can prevent that from happening. And if you have that happened to you, you may need a device that we can help you save your life in the future.
And so just to sort of recap on all that, you can't know a lot of this unless you talk to your family, get the history, talk to your doctors, to bring in your medicines, let every care provider who's seeing you know what medicines you're taking, what your underlying conditions are, and get the proper screening that you need.
Well, I want to say one more thing about hypertension. It's a cause for what we call atrial fibrillation. I'm sure everyone heard that term, atrial fibrillation, where the top part of the heart, which is called the atria, quiver about 300 times a minute. And the heart, when it quivers like that, doesn't contract. So you build up clot in the top part of the heart, and that clot can get dislodged and go to the head and cause a stroke. So atrial fibrillation is a problem with hypertension. Now you may also get a condition called atrial flutter. It's kind of a clockwise arrhythmia that can also lead to stroke because it can cause clot buildup in the top part of the chamber. So those are the two main rhythms that can be precipitated by uncontrolled hypertension, the atrial fibrillation and the atrial flutter.
Excellent.
Doctors know how to treat that.
See your doctor. Get your blood pressure checked on a regular basis. Talk about your family history. Get in the best condition you can before you get pregnant, and we'll monitor through that. Know what medicines you're on when you see any doctor, but dentists might certainly need to know that information as well, and it can affect your dental care.
Absolutely. Let's
move on to diabetes. As pointed out, it's another risk factor for cardiovascular disease. Dr. Dawson, can you tell us what is diabetes?
So diabetes is increased blood sugar levels in your body. And so we test this by testing a hemoglobin A1C. And so again, when you see your doctor, they're going to draw blood potentially, or even do a finger stick on you to see if you have diabetes. And so what we use is called a hemoglobin A1C. So I always tell my patients, you want your numbers below 5.6. So 5.6 or lower is normal. If it's 5.6 to 6.4, you're pre-diabetic. And so we're going to then start having, just like the hypertension, some conversations about, hey, this is what I'm looking at. Your sugar levels are consistently going up, and we need to make some changes before you have to be on medication. And then 6.5 or higher is diabetes. And so one of the biggest things I tell my patients about diabetes is diabetes affects every aspect of your body, very similar to hypertension and cardiovascular disease. And so if you think about it, it affects your kidneys, it can increase your blood pressure, it can literally cause your nerves to start to weaken, and then you get ulcers in your feet, so you could lose a limb. It increases your risk of infections. And so I try to tell my patients the things I'm trying to prevent in you are the things that could alter your life and your way of living. And so we want to limit that as much as possible. So we have to control your diabetes. And so I think that is a big thing that your doctor is going to talk to you about when your sugars start to go up.
And sometimes we can control that with lifestyle changes, as you pointed out.
Absolutely.
Sometimes we need to go on to medicines. But if you need to go on medicines, don't be like some of my friends. I refuse to accept that I have diabetes, so I'm not going to take any medicines, because it can help us not have to have dialysis or amputations or heart disease and cardiac procedures. But Dr. Love Davis, certainly diabetes is a concern in pregnancy. Can you talk to us a little bit about the importance of control of diabetes in pregnancy?
Well, it points to knowing what your A1C is before you're actually pregnant, and a lot of times when women come in, and if they have not seen a primary care provider, if they have not gotten an A1C, they literally could not have any clue what's going on.
And as she pointed out, just to reiterate, an A1C is like a blood test.
It is.
Right.
It's a blood test. And like you said, even a little finger stick sometimes. And so if you come in and your hemoglobin A1C is over 6.5, again, we have diabetes. If it is incredibly high and we just have not known it, but we are still pregnant, and again, a lot of times we see our OB doctor the first time, maybe around 8 weeks, 10 weeks. Well, that's the time that our baby's organs have already done the development part of it. And if our A1C is high, if our blood sugars are very high, then that can literally affect our baby's anatomy. There are some cases that there are neural tube defects that happen. There are even sometimes that in the worst case scenario that their limbs are affected. And all of this can happen in the time frame before you actually see your doctor, which again, it's important why to know. Then if we do have diabetes in pregnancy, or if we develop what's called gestational diabetes, it's incredibly to know what our blood sugars are on a daily basis. It's actually more than daily. It's usually 4 times a day. And the reason why is because if our blood sugars are not in control, then that affects our baby's growth. And so a lot of times we think, oh, cute little fat babies, but actually babies who are large, or what's called large for gestational age, or macrosomic, there are risks to that. There are risks in labor. There are risks in birth. One of the biggest birth emergencies is something called a shoulder dystocia. Well, that happens a lot of times when our moms have diabetes or gestational diabetes and they're not well controlled, and literally how their babies grow is different.
And a shoulder dystocia.
Yeah.
I mean, you're being kind with it.
It is a fear that I have in my heart.
The most frightening thing in obstetrics, in my opinion.
The most frightening thing, if you can imagine, a baby's head is born and then the shoulders literally get stuck, and then there's no oxygen to the baby. And so we're doing all of these different maneuvers and trying to get, but oxygen, just like food is medicine, oxygen is medicine. And so less oxygen to our babies can affect them for the rest of their lives, literally. And so when our moms are not well controlled with gestational diabetes or type 2 diabetes, or even type 1 diabetes, and the shoulder, then there's a shoulder dystocia because their babies grow differently. Their bodies are formed differently. And so again, that not only affects the baby, but affects the moms. A shoulder dystocia can be considered a birth trauma. We remember those things. And so all of these things I want us to think about in our pregnancies. And I know that it's a lot. I know that moms are working, and it is hard to do blood sugars 4 times a day, because that's often what we ask. We ask for fasting and then 2 hours after breakfast, lunch, and dinner. But if we think of those things that can affect our baby's life and their development and their grades in the future, if they have less oxygen because of a shoulder dystocia, all of those things, that's why we do it. And that's why it's important to know beforehand.
I agree. And even to your point, sometimes we say, oh, based on what we think the weight is, we don't even want to try for a vaginal delivery because of that fear.
That's
We're going to
exactly
recommend
right.
the C-section. If we could avoid that by controlling your blood sugars early on. I just do want to stress too, the better you are, the better you are. So the better you are early in pregnancy before you realize you're pregnant, because as Dr. Love Davis pointed out, when you are, that heart is forming at 5 to 6 weeks of gestation. Often women don't realize they're pregnant. When you're poorly controlled with your diabetes, you're more at risk for neural tube defects, which are spinal cord defects and heart defects, and then later on. And so we want to control that as best as possible. And we can do that with diet and lifestyle changes. We may even diagnose it in the middle of pregnancy, and that's a whole discussion for another thing, but it has to do with diabetes and pregnancy, and the better you are, the better you are, so we control it.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.